California will require healthcare settings to verify that workers are fully vaccinated or tested regularly. Unvaccinated workers will be subject to at least weekly COVID-19 testing and will be required to wear appropriate PPE. Dr. Jim Schultz is the chief medical officer at Neighborhood Healthcare with 16 facilities throughout San Diego and Riverside County.
We want our patients to feel comfortable that they're not going to come here and catch a disease that they didn't come in here with. So I think it's, our responsibility, our ethical duty to our patients to make sure that we don't make them any sicker than they are.
Approximately 70% of neighborhood healthcare employees are vaccinated. Schultz hopes the new healthcare protocols encourage the rest of the staff to get vaccinated.
Testing's not the most pleasant thing in the world, so that might convince some people. Also, the threat of, if the test comes back positive, they have to stay off of work for several days, and they may or may not have sick time available to them.
Dr. Schultz agrees with Governor Newsom's new vaccine policy.
We need all of our healthcare workers. We need all of our staff because we're very busy right now with COVID, and we can't really afford to have healthcare personnel offline sick with COVID, dying from COVID, or just infected with COVID.
Newsom's orders also apply to workers in high-risk congregate settings, like jails and homeless shelters. Dr. Schultz says this is important.
Especially with this Delta variant, which is much more contagious than the other strains have been, it can really rip through any sort of congregate setting.
Schultz says neighborhood healthcare is making it easy for staff to get vaccinated.
We have, for ever since the vaccines came out, we have set times where anybody can get any of our employees can get a vaccine. And really, if anybody asks for it at any time, we have a good supply of vaccines, and we can get them the vaccine.
Melissa Mae, KPBS News.